On Trots TV, it's time for the doctors in again. Dr. Nick Kanagita is back with us. Hello, Dr. Nick.
G'day, Gary.
We're going to have a chat today about bleeding, and quite common in horses, isn't it?
Yes, it's actually very common, and far more common than a lot of people realise. And there's been a lot of work done and a lot of research done on bleeding over the last 20 or 30 years, because it is such a common problem in the industry, and not only in horses. It happens in human athletes as well. If they exert themselves too hard, they'll bleed. But horses do bleed more so than people, and the reason is because of the extraordinarily high blood pressures they generate in their lungs, and it's just part of their physiological response to exercise. They've got a huge set of lungs, and big demands from muscles for oxygen, and so the blood pressures that are necessary to get the blood through the lungs, exchange fresh oxygen in there and then round to the rest of the body, is massive, absolutely massive, and far higher than most other species. In fact, it may be higher than any other species. And so what happens is that as these horses are exercising, the pressure in the blood vessels gets to this very high level, and the vessels just rupture because the pressure is just too high. And the difficulty is, you say, well, why doesn't the horse make the vessels stronger? But they need to be thin to allow that the oxygen exchange between the lungs and the vessels. And if it's too thick, you don't get any movement or transfer between the two. Mm-hmm. And if, say, you wouldn't get any oxygen, and they wouldn't rupture, but the horse wouldn't be able to do anything. So it's a fine line between having this optimal strength to the vessels and then not being strong enough for the exertion that they do. So when the vessels actually rupture, you end up with blood then pouring into the lung space, and in a lot of horses it just is localised in the back of the lungs, not much happens. But if it happens more severely and there's some big bleeds, then the lungs start to fill up, and because of the air going backwards and forwards, it then appears at the nostrils, and you can actually get frank blood pouring out the nostrils in a severe case. And it looks a lot more dramatic than it is. Blood tends to go a long way. And if you put blood in a fan, it makes a mess. So even though it looks dramatic, it might only be a small amount of blood, but it still does always look dramatic, and it's not a good sight at all. And so these horses will bleed. Now, probably 3 to 5% of horses after exercise will end up with some blood at the nostrils. But if we actually look all the way down the lungs to the back of the lungs, we know that in excess of 95% of horses have some degree of bleeding during their career. And so that's how common it is. Not all those horses will bleed severely enough so that it appears at the nostrils, but they are bleeding a lot. And of course the rules are that if they bleed once, they have a break, bleed twice, there's more serious consequences. So bleeding is a big issue in the industry and a big cause of wastage. Now the bleeding rules around the world and between standardbreds and thoroughbreds varies dramatically. In Australia we've got some of the strictest rules regarding bleeding, but in the US they're far more lenient, and in some of the Asian countries they're far more lenient on that, and that recognises that it is such a common problem, and that if they were to ban all the horses that bled, they won't have any horses left to race. So there is a variation in the rules, but the rules we've got state, we've got to work with those. So what can we do about a horse that bleeds? Well, a few things to do. One is horses will often bleed if they've got some low-grade airway disease. And it doesn't necessarily need to be an infection, it just needs to be inflammation. So if they've been exposed to a very dusty stable with a lot of endotoxins and a lot of irritants in that stable environment, that can cause irritation of the airway, inflammation of the airway, and with inflammation it weakens the airway and the vessels, and it can increase the risk of bleeding. So the first thing is to make sure your horse has a really healthy airway. Yep. And that you minimise the risks then of bleeding, or decrease the risks of bleeding. So good ventilation, make sure the stable's kept clean, minimal dust, and that can help. One thing that always amazes me is how many horses are actually fed and watered from an elevated position. That's completely unnatural for the horse. Every horse should have their hay, their food and their water down on ground level.
Right.
And that's something just every stable should do that, and so that helps their natural drainage from the lungs. That's how they're meant to eat normally. They're not, they don't eat out in the wild with their heads up. They always down, and then it helps drain their lungs. So you should do that, and that will help them. But having said that, make sure where they're eating is not in a super dusty environment, because if you just put their food down in a dusty stable and they're still kicking up more dust, that's just as bad. So make sure you've got to really decrease the dust in your stable as much as you can, as much ventilation as you can. The cold's not going to worry them. You want ventilation in those stables, so make sure you've got as much open windows and open space as you can to minimise your lung disease. The other thing is some horses will bleed more if they're pulling a lot in the run.
Yep.
And so you need to try to settle them as best you can, and that's often hard to do. But we find that horses that are really struggling and pulling against the bit, they're the ones that are putting extra strain on their lungs, so that can happen.
Something we see in America, especially in harness racing, the use of Lasix is obviously they can't race on Lasix here in Australia.
No.
In terms of horses and horse health, it's obviously a good thing.
It is an excellent preparation product for managing horses that are prone to bleed. In fact, some big stables routinely give all horses Lasix before fast work, just to prevent bleeding happening, because once bleeding has occurred, it's more likely to happen again.
Right.
So if you can minimise it happening and minimise the severity of it from the beginning, then you're less likely to have a problem. And Lasix, which is furosemide, is the actual drug, is as a diuretic, and nobody really knows how it works. The theory is, I think, that it lowers the blood pressure selectively in the lungs, so they actually have reached lower levels of blood pressure, which is a good thing in these lungs. It also does dehydrate them a little bit, and so they're actually lighter, the horses. So there's no doubt that Lasix will improve performance if given on race day, even if it doesn't, stop the bleeding. Through other effects of the drug, it does tend to have a performance-enhancing effect. So in the US, as you say, they have races where all the horses are on Lasix, or pretty much they're not, and that's not such a bad way to go if you're looking at purely trying to minimise damage to the horse. But in Australia, again, we've got the rules that say no Lasix on race day, but doesn't mean you can't give it on training days. And we certainly would encourage people to give an injection, intravenous injection, a couple of hours before a fast run, and that will minimise the risk of damage to the lungs. Particularly if you have had a horse that's already bled once, or you know he's got a bleeding problem, you've scoped it a lot after fast work, and you've seen blood in the lungs and things. They're the horses that can really benefit from Lasix. It's excreted very quickly, so as long as you haven't given it within 3 days or so of racing, it shouldn't appear in the race day sample. So you can use it as a management tool on non-race days to minimise the effects of bleeding. And really, there's not a huge amount more you can do.
Scoping, that's the only way you're going to tell if your horse is having a bleed?
A minor bleed, yes. Yeah, and we normally will scope them a few hours after racing or fast work, and that's given any blood that's in the back of the lungs time to come down into an area that we can see. Because we can only see just down to where the lungs join up to the bottom of the neck is where we can really see into the lungs. We can't get right up to the back of the lungs. You can x-ray them and ultrasound them, and sometimes seems to damage as well, but the endoscope is the best way. So if you've got a horse that coughs a few times after fast work, or its performance has dropped off a lot, certainly endoscope them and have a look to see if there's any blood. Or the other thing that the vet might do is put a tube either down the nose or through the trachea, through the windpipe, into the lungs, flush some fluid in there, some sterile fluid in there, swish it around a bit and pull it back. And sometimes that'll come back really dark red because there's blood right down in the lungways. And that's a pretty sensitive test as well. And even sometimes it looks reasonably clear, but we'll look at it under the microscope and you'll see evidence of bleeding in that. So there's been a lot of blood at some point in that horse's history. And you can then try and manage it with medication, pacing it during the run so that it's not going not fighting too hard, and making sure the airways are clear. And there are other things that people have tried to minimise it, bronchodilators and things like Atrovent. People try all these things. Quite how well they work, I think if your horse has got respiratory disease, they'll help a little bit. But in terms of actual stopping bleeding, some of them will help, but again, it's very hard on race day you can't use them on race day and you can't use them immediately prior to racing, so the benefits aren't quite as good as with Lasix. But again, it's something your vet might want to talk about, using that.
All right, Dr. Nick, thanks for your time this week.
No worries.
There he is, Dr. Nick Kanagita this week, talking about bleeders.